High blood pressure. It's a topic that affects so many of us. Well, the American Heart Association and the American College of Cardiology just released their brand new 2025 clinical guidelines, basically the new playbook. So let's dive in and break down exactly what's changed and what it means for you.
First things first, let's just establish the stakes here. The guidelines don't mince words. High blood pressure is the #1 most common and most modifiable risk factor for a whole list of really serious health problems. And that word, modifiable, that's the most important word on this entire slide. It means this is something we can actually do something about.
And if you're thinking, oh, this probably doesn't apply to me, think again. For anyone who is currently middle-aged, your lifetime risk of developing high blood pressure is a staggering 90%. Let that sink in. 9 out of 10. So yeah, this explainer, it's for pretty much everyone.
You know, the really scary thing about high blood pressure is that it's often called the silent killer. And for good reason. You can feel totally fine, completely normal, while inside your body is under a dangerous amount of strain. That's why we have to talk about it. We have to make this invisible threat visible.
So, how do you fight a problem you can't feel? Well, you have to measure it. You have to drag it out into the light. And that's why the absolute foundation of managing blood pressure is knowing your numbers. This isn't just about collecting data. It is the single most powerful first step you can take to get back in control.
Okay, so here's the official scorecard from the guidelines. You've got two numbers, right? The top number, systolic, is the pressure when your heart beats. The bottom number, diastolic, is the pressure when your heart rests between beats. Normal is anything under 120/80. Now, pay close attention to the word "or" for stage 1 and 2. That means if either your top number or your bottom number falls into that range, you're classified in that category.
But where you get your numbers taken is absolutely critical. A one-off reading at the doctor's office? That's just a single snapshot. You know that feeling. You're a little stressed, maybe rushed. That can cause a temporary spike. We call it white coat hypertension. That's exactly why the new guidelines so strongly recommend monitoring your blood pressure at home to get a much more accurate picture of what's really going on.
Now, if you're going to measure at home, you've got to do it right. Otherwise, the numbers don't mean much. The guidelines lay out a super clear 4-step process. You prepare, get in the right position, measure correctly, and then you record it. Following these steps ensures the data you give your doctor is pure gold.
All right, before we even get into talking about medication, the guidelines put a huge emphasis on lifestyle changes. I like to call it the lifestyle prescription because honestly, it can be just as powerful as anything you get from a pharmacy. And here are the heavy hitters. You can see the whole list here, everything from weight loss to getting more potassium. But what's really interesting is how specific and serious these recommendations are. Take alcohol, for example. The guideline says the optimal goal for blood pressure control is complete abstinence. That's a pretty strong statement. And just in case you think these are minor tweaks, check out these numbers. Following the DASH diet alone can lower your systolic blood pressure by an average of 11 points. That is huge. That's more of a drop than some medications provide. So no, these are not just suggestions. They are legitimate, powerful treatments in their own right. Now, for many people, lifestyle changes are just one part of the puzzle, so let's open up the medical toolkit. Medication is a critical tool that works right alongside those lifestyle efforts to protect your health for the long run.
So what's the target? What are we aiming for with all this? The guidelines make it crystal clear. For the vast majority of adults being treated for high blood pressure, the goal is to get your numbers below 130/80 and keep them there. When medication is needed, these are the proven go-to options. They all work a bit differently. Diuretics, for instance, are often called water pills because they help your body get rid of extra salt and water. Others, like ACE inhibitors or CCBs, work by helping to relax your blood vessels. The bottom line is, they are all well-tested and proven to lower blood pressure and prevent serious complications.
Okay, so we've covered the basics, but this is the 2025 playbook, right? So what's actually new this time around? These guidelines are an evolution, building on what we already knew and adding some really important refinements based on the very latest science.
This is the big question, isn't it?
Medical science is always moving forward. So let's dig into 4 of the biggest, most impactful changes you need to know about.
First up, we've got a really practical tip you can use in your kitchen today. The guidelines are now officially recommending potassium-based salt substitutes. So if you're someone who adds salt to your food at the table, just making that simple switch can be a surprisingly effective way to help lower your blood pressure. This next one is absolutely critical. The guidelines are much stronger and clearer when it comes to pregnancy. They specifically call out certain drug classes like ACE inhibitors and ARBs with stark warnings to avoid them if you're pregnant or even planning to be, because of the risk of harm to the fetus. Here's a fascinating example of how medicine gets more, well, nuanced. For some patients who've had a stroke, the new advice is actually more cautious. It turns out that lowering blood pressure too aggressively too soon can sometimes do more harm than good. So now a more careful, deliberate approach is recommended. And in a very 2025 update, we have a warning about technology. A lot of us have smartwatches and other wearables that claim to measure blood pressure. Well, the experts are saying, not so fast. For now, they say these cuffless devices are just not reliable enough for making real medical decisions. Stick to a validated cuff-style device. So, we've covered the problem, the solutions, and the latest updates. But all this information is pretty useless if we don't actually put it into action, right? It's time to talk about your path to control. One of the core themes woven throughout these new guidelines is that you are not in this alone. Managing blood pressure effectively is a team sport. And, as you can see, the team includes doctors, nurses, pharmacists, but look who's right there in the center. You. The patient is the most important, active member of the team. If you only remember 3 things from this whole explainer, please let it be these. Number 1, that 90% lifetime risk means this matters to you. Number 2, you have to know your true numbers, and that means accurate home monitoring is absolutely essential. And number 3, the goal is below 130/80, and you get there with powerful lifestyle changes and, if you need it, medication. And that brings us right back to where we started, your numbers. Knowing them is the first step. It's the starting line. But knowledge alone doesn't change anything. So the real question isn't just about what the guidelines say. The real question is, what will your next step be?